Lateral trunk rotation is a fundamental movement in the body's biomechanics, where the torso turns to one side without excessively shifting the pelvis. This movement is key in everyday activities, such as turning to look behind, reaching for objects to the side, or performing tasks like driving. Moreover, it is essential in sports like golf, tennis, and baseball, where efficient rotational mobility is crucial for performance and injury prevention. This movement primarily involves the external and internal obliques, the spinal erectors, and the thoracolumbar fascia, among others. Proper activation and synergy among these muscles ensure smooth and safe rotation, preventing compensations that can lead to overload in the area. Lumbar or thoracic. Ineffective or uncoordinated muscle function in lateral trunk rotation can contribute to pain, stiffness, or postural alterations. If you have patients who exhibit restricted mobility, weakness, or discomfort when bending the trunk, the key question you should ask yourself is, which muscles are not functioning properly so that my patient can perform lateral rotation with quality movement? In this post, you will learn how to evaluate muscle synergies in lateral trunk rotation. To identify imbalances and precisely guide your treatment towards the muscles that need retraining, first, you will learn which muscles are most activated in lateral trunk bending to the right. First, the right external oblique. This muscle pulls the ribcage towards the pelvis on the right side, facilitating lateral bending to that side. Second, the left internal oblique. It works to stabilize the trunk and assists in compensating the abdominal cavity. The right spinal erector plays an important role in keeping the spine vertically stabilized during the movement, preventing any unwanted flexion or rotation. Finally, the rector spinal left, similar to the right but to a lesser extent. Therefore, the expected synergy in lateral trunk bending to the right is the external oblique. The right one is activated more than the left internal oblique, more than the right spinal erector, and more than the left spinal erector. Are you going to learn to appreciate this synergy in the lateral rotation of the trunk with a real example of a patient with lower back pain? When analyzing muscle activation in a lateral trunk rotation, it is key to observe the synergy between the muscles involved. In this case, our patient shows the following pattern. The left spinal erector is activated more than the right spinal erector, more than the left internal oblique, and more than the right external oblique. That is to say, the spinal erector has an excess of activation, indicating that it is overcompensating, which can lead to overload and lower back discomfort. We have a deficit in the activation of the left internal oblique and the external oblique, right, which suggests a lack of involvement of this musculature in the rotation and reduces the efficiency of the movement. This dysfunctional pattern can lead to chronic lower back pain, core instability, and compensation in movement mechanics. Identifying these imbalances with EMG will allow you to design more precise and effective treatment strategies. Now we are going to see an example of a normal pattern. An appropriate muscle activation pattern is key for efficient lateral rotation without discomfort, and you will see how it is performed. In this case, we have that the right external oblique activates more than the internal oblique, left more than the right spinal erector, and more than the left spinal erector. This balance allows for a stable and effective rotation where the oblique leads in the movement, and the spinal erector performs a stabilizing function without generating overload. If we compare between the normal pattern and the pattern with lumbar pain, notice that the left spinal erector with lumbar pain activates 3 times less than that of a healthy person. This low activation can compromise stability and cause compensation in other muscles. On the other hand, the healthy external oblique activates 3.5 times more than the oblique of the patient with lumbar pain. A deficit in oblique activation reduces movement efficiency and increases the load on the lumbar area. Therefore, understanding muscle activation during lateral trunk bending is key to evaluating and optimizing this movement. A detailed analysis allows for the identification of imbalance and compensation, which helps prevent and treat dysfunctions that may lead to pain or functional limitations. In a correct activation pattern, the external and internal obliques should act as the main agonist, leading the movement with predominant activation. If other muscles, such as the spinal erectors, take on an excessive role, compensations may occur that affect the efficiency of the movement and increase the risk of overload. Thanks to surface electromyography, it is possible to objectively measure muscle activation and correct dysfunctional patterns. See you in the next post.